For some mothers, plastic surgery is an option to consider in an effort to restore their body to the way it was pre-baby. Dr. Sergio Maggi and Tricia Rollman of Austin Plastic Surgery are here to talk more with us about what's known as the new Mother Makeover. Thank y'all for being here today.
Hi, Amanda. Thanks.
Tell me about the new Mother Makeover, Dr. Maggi, what that entails.
Well, it's basically to treat areas of the body that are affected after pregnancy, maybe after the second, third child in particular. And the classic scenario is the woman comes into the office, says, I've been working out, my trainer tells me it's going to change certain areas, for example, my lower abdomen's not changing, I do crunches, what can I do next? And that's more of an understanding that there's some changes to the tissue, to the skin in particular, it's been stretched out possibly, and genetics, your DNA, and that doesn't come back. And all the sit-ups in the world aren't going to change it. It really needs to be treated surgically if you want to improve the area. And that would be either some liposuction of the region or most likely a tummy tuck or abdominoplasty to contour the abdomen, give back a nice silhouette and an attractive abdominal area that you don't feel that you need to cover up anymore. So that's the purpose of the surgery for the lower the lower portion of the torso or the abdominal area. And then the other area that's affected significantly are the woman's breasts, especially if they breastfed, especially after the second child, third child. And typically they come to me after they've had their children and they say, okay, I'm done with children and my husband now says he'll take care of this because now it's my time. And then the focus is, what is your goal? What do you want to achieve? And it's about the patient's aesthetic, what their specific desire is to change. For the breast, sometimes it's just restoring the position, which is a breast lift, or combination with a implant or an augmentation to give back some fullness, particularly in the upper portion, which women feel that that's where they feel more feminine, and also they fit their clothing better, and they want to restore back what they had in their 20s. And that's the combination.
So Tricia, you can speak to both sides of this. You've been in the office for a long time working with Dr. Maggi, and then you're a mom of a 5-year-old. And how does it feel just to confidence-wise to have things back in place as you wanted them, and how do you help patients moving forward in their recovery?
Yes, it's very important confidence-wise. I mean, a woman needs to feel like a woman, and I can attest to that. Being a mother, a wife, avid workout person. I've been with Dr. Maggi for over 4 years now, and in all of the appointments, what my main goal is to see these women get to the point where they look at me after post-op care and they're healed and on the way to go, and they're in tears when they see what it's done to their silhouette, happy tears. And then I cry, and it's a very emotional feeling to see that we are able to help people feel a certain way. And that's exactly what I love about where I work and what we do, because it just gives something back to the woman that they know that that's what they need, and to feel just more like a woman.
And Dr. Maggi, quickly, you said you can tailor this to each patient. It doesn't mean you have to do everything.
It has to be tailored. It has to be, again, the question is, what do you want to achieve? What are your value? What's the value that you want to gain? What's your goal? And then to address it in a way that gets them there in the safest and the most predictable way.
All right. Thank you both so much for being here. We appreciate it. And go to drmaggi.com to learn more about their procedures, to meet the team, and to see their private surgery center or to book a consultation.